Hi, this is Dr. Ben Young, and you are listening to the Perio Patient Podcast, episode 39. And I want to talk about where we are with COVID right now. So, this will be brief, and I don't want to rehash all the controversies associated with this COVID-19 and the lockdown. We are dealing with this all the time. But I do want to walk back with you for a moment and explain where I think we are with this unique, historic pandemic event. Right now, I will tell you that just this morning, as I drove to work, there's more traffic on the road than I have encountered since before the lockdown. I don't think it's 100% back yet. For one thing, I'm not seeing many school buses, but it isn't the ghost town it was in May. So let's go back to the beginning of the year. Actually, New Year's Eve was when the report came out from China, Wuhan, China, that there was an outbreak or something unusual having to do with that, with a viral infection that had gotten out. And it was until January 31 when a travel ban was introduced, and it was a partial overseas travel ban from Asia, actually from China, I'm sorry. And it was announced January 31 and took effect February 2. It was partial in that it allowed citizens to return home with the idea that they would be evaluated for symptoms and quarantined for an appropriate amount of time, usually 2 weeks. And this didn't happen very well, I'm sure, because this virus is invisible and we couldn't see it until we began to see it spread as it infected people, and we saw symptoms in very sick people at first. Well, since then, we have come a long way, baby. And that's what I want to talk about. I want us to think about right now. It's so easy to take what we know about this particular virus now and apply it with what-if questions about how this situation was handled. Let's just remember that at first, for this illness to attract medical attention, the infected person would have to seek medical help, which back then was often showing up in the emergency room and being admitted to the ICU to be put on a ventilator. And this doesn't take into account all the other people around the sick individual who was admitted who were infected at the time. So the spread began. So back just a few months ago, being infected with COVID-19 was synonymous with hospitalization and difficulty breathing. Also, recall that the first deaths were on the West Coast and associated with long-term care facilities in Washington State. Also, at first, the attempt was containment by searching for others who may have been in contact with the infected individuals. The problem quickly became that this virus was infectious enough to override contact tracing. That contact tracing is that attempt to find everyone who had contact with the one known to be infected. It works for some infectious diseases, for example, sexually transmitted ones, but not others like this one. It's just too infectious. So then, the logical fear was overwhelming the medical system back then. And at first, I think this was a strong possibility. If we had not done the things we did to slow down the infection rate, not keep people from being infected, but spread them out, which meant closing down much of the country, it might have been catastrophic because it could have resulted in hospitals being filled with just sick medical workers and limited important medical supplies and equipment. I know you know this already, but I'm asking you to recall how important this was at the time. So what is the difference now? Very simply, we now understand how to turn the respiratory problems around earlier in the disease cycle. This means fewer people will show up in respiratory distress in the ER. Many are getting the help they need as outpatients earlier in the disease process. Also, we now know what cells in the body this coronavirus invades, and we know a lot of ways to reduce its ability to do so. But again, I'm bringing this up because there is this natural tendency I'm noticing to forget where we've come from and where we are right now. Some want to believe that nothing has changed with regards to therapeutics since the lockdown, and the death rate is the same now as it was then. Not true. Others want to write it all off as if the whole lockdown was unnecessary. Both of these positions are wrong, in my opinion. We have to be grateful to those healthcare workers who were truly risking their lives to care for those sick with this virus at first. And this may still be going on to some extent in many locations. It's just that now, for most of the population, the risk is acknowledged, even by experts, to be extremely low. As for the rest of us in healthcare, who are not responsible for treating the illnesses associated directly with COVID-19, I think it is important for us to continue to treat patients for all the other problems that still require care. Taking temperatures, limiting patients in the office, improving air filtration, wearing masks, and washing hands are all important in order to return to normal as much as possible, because health is more than managing problems associated with just one virus. And I know it's getting old, but in general, we are getting through this as communities who have had to cooperate in new ways for the benefit of all of us. So let's hang in there and count our blessings. I won't say that this pandemic was a good thing. That's ridiculous. But it has brought about some good things which are important to keep in mind. For one thing, the medical research that has been accomplished in order to unravel this new virus, I continue to believe will pay dividends in the future in ways we have yet to truly appreciate or even imagine. That's it for today. Just a few thoughts at the end of another busy day, and I hope you have a great evening and the rest of the week. This has been the Perio Patient Podcast, and I am Dr. Ben Young, a periodontist practicing in San Antonio, Texas. You have a good day. I stayed up all night to see where the sun went, and then it dawned on me.